We are back this week for the GI assessment. I have Karen back with me. Karen is a 54-year-old female. For purposes of this video, I'm a little shrunken down. I don't have anyone to record it, so just bear with me. I have Karen set up here. The first part of the GI assessment is to observe the actual abdomen. So I am observing it now. I don't see any open areas, any rashes, any hernias. Abdomen does not look distended. Her umbilicus is mid-abdominal line. So now what I'm going to do is I'm going to auscultate bowel sounds in all four quadrants. So bowel sounds are positive in all four quadrants, and they're active. Now I'm going to listen in the four different areas on the abdomen for bruit. So I'm going to start at the aortic. Which is up here. I don't feel anything. I'm going to, I don't hear anything there. I'm going to come down over here. I don't hear anything. I'm going to come down to the iliac crest. And then I will move down to her femoral, which is a little bit hard because for purpose of this assessment, but I would move down to her femoral pulse and feel that. Now I'm going to palpate her abdomen. As I said before, it was not distended, no tenderness, and you keep in mind to watch your patient's face so that you can see if they're grimacing while you do this. Good. Now I'm going to use two hands to get a little bit deeper into the assessment so I can kind of palpate for masses in the abdominal area. You want to make sure that you're palpating in all four quadrants. While I'm over here, I'm going to palpate the spleen. I'm going to have you breathe in for me and out. I can't palpate the spleen, so for purposes of the assessment, I'm going to say the spleen's non-palpable. I'm going to come over here and palpate the liver. And have you take a deep breath in for me and breathe out. Liver is also non-palpable for the assessment, which is a normal finding because it's not always palpable. And now I'm going to percuss. Everything sounds the same. I'm going to come over back into the spleen and percuss the spleen. And I'm going to come down to the liver, percuss the liver again. Well, for the first time, but. Okay. I'm going to have you turn to the side towards the wall, onto your side. I'm going to assess and palpate and percuss her kidneys. Kidneys are only accessible for an assessment on the lower back. So first I'm going to palpate, and they're kind of tucked up in the rib cage. No masses, everything sounds and feels good. And that completes my assessment.